The surge in mental health problems during and after the COVID-19 pandemic is prompting government action, with the Biden administration proposing new rules that would require insurance companies to expand their mental health coverage. Kevin Cork reports on the latest.
Access to mental health care for millions could soon be expanding. The Biden administration announcing new rules Tuesday that would require insurance companies to increase their coverage of mental health treatments.
I don't know what the difference between breaking your arm and having a mental breakdown is. It's health.
According to the 2008 Mental Health Parity and Addiction Equity Act, insurance companies must offer the same level of coverage for physical and mental health. Still, the Biden administration says patients' access to mental health care is being restricted by many insurance policies.
Their networks of providers are badly inadequate, with far fewer psychiatrists, therapists, and other mental health professionals.
Citing how many families are forced to pay huge fees to see out-of-network specialists because there simply aren't enough in-network therapists available.
In 2020, less than half of all adults with mental illness diagnosis receive care for it. Nearly 70% of our kids who seek care for mental health or addiction cannot get it.
If the president's rules are passed, insurance companies would need to review their policies and evaluate their coverage based on the number of network providers, the cost associated with getting out-of-network help, and more. President Biden's rules will be open for public comment for 60 days. Officials are confident the proposals will ultimately be passed. In Washington, I'm Kevin Cork, Fox News.
An animal sedative is further fueling America's drug crisis. Many dealers are lacing it with other drugs to create a deadly concoction known on the streets as Trink Dope. Alexis McAdams is here with more details. Alexis?
Trink is having devastating consequences across the country. I talked to a mom, Loretta Mazzoni, who tells me about the call that changed her life forever. It was from the county coroner out in Pennsylvania telling her that her son had overdosed.
They took him out by ambulance and they kept trying to give him Narcan, but Narcan does not work with xylazine. And they didn't know. They did not know that it was xylazine. They didn't know. A lot of hospitals don't know. And the Narcan wasn't working. And they tried to resuscitate him, and he died like within 15 minutes after he got to the hospital.
Dylan Curran was 32 when he died back in December after his family tells me he bought what he thought was heroin out in Kensington. That's a neighborhood with an open-air drug market in Philadelphia. But it was laced with fentanyl and the animal tranquilizer xylazine. Dylan's story is unfortunately just a glimpse into the death toll that Trink is having on America. The DEA says it seized xylazine and fentanyl mixtures in nearly every single state. And just last month, the Centers for Disease Control and Prevention reported that the percentage of fatal opioid overdoses in which xylazine is detected is up by, listen to this, 276% just between January of 2019 and June of 2022. So the drug has horrible effects on humans, as we've talked about before. It causes people to walk around slumped over, pretty much unconscious, and it covers their arms and legs with large wounds. And here in New York City, the special narcotics prosecutor tells me that her team's going after these dealers. Investigators busting into stash houses, finding large bags of drugs just like this that have been cut with xylazine.
It's all about making the bucks. There's no concern for human life. It's only about money. So to the extent we can hit these organizations where it hurts, in their pocketbooks, that's another effective tool.
So what's being done to stop this? Well, the White House is working to make this drug a controlled substance, so that would limit availability. And in March, President Biden asked Congress for more than $46 billion for nationwide drug programs, but nothing yet. Reporting in New York, I'm Alexis McAdams, Fox News.
We're back in just a moment.